All seen the telltale wrist brace associated with carpal tunnel syndrome. Maybe you've even experienced this issue yourself.
Yeah, so what is this condition? How do we treat it or even prevent it?
Well, Dr. Stephen Goldberg, an orthopedic surgeon and fellowship-trained hand specialist, is the man to see. He's at Bell & Health Titletown here to answer those questions. Good morning.
Thank you so much for having me.
Okay, so you know, a lot of people have heard of carpal tunnel syndrome, but we don't know much beyond that. So what is it?
So carpal tunnel syndrome is one of the most common things that I'm asked to see and evaluate. And so it's a compressive neuropathy where pressure is applied to the median nerve at the wrist by normal anatomic structures. And so sometimes as we get older, these structures somehow change a little bit and result in an increase in pressure that then generates symptoms of numbness, tingling, weakness, and sometimes dropping objects. And so it's really common and very easy to treat.
Yeah, and as you mentioned, you know, tends to happen as we get older. Are there other certain groups that are more at risk?
Definitely. There are certain groups of people that seem to have a higher incidence of carpal tunnel. Typically, it tends to be patients that are increasing in age. So kind of with every decade of life, you have a higher likelihood of getting it. So it's very rare before age 30 and then increases beyond that. So age is the major risk factor. Sometimes other medical conditions like diabetes can also increase the likelihood of developing carpal tunnel. Occasionally there may be activity-related things that can increase pressure at the wrist level and increase the likelihood of developing symptoms.
Okay, so what do we do about it? How is it treated?
That's a great question. So one of the first lines of treatment is trying to figure out what symptoms may get increased by certain activities. So if you can identify something that increases the symptom, it's very helpful to try to reduce that activity if possible. Often we also recommend splints to wear at night. Those help keep the wrist in the neutral position and avoid hyperextension and flexion, and that keeps the pressure more even across the wrist. When those splints alone fail, we can go to things like steroid injection as well as therapy to try to reduce pressure and improve function. And when those couple modalities are unsuccessful, there may be a surgical alternative that can help relieve pressure and eliminate symptoms.
All right, so you're talking about ways to treat it if someone does have it. What about just preventing it in the first place from ever occurring? Is that possible?
It's really challenging. It's a great question as well. So since it is most likely age-related, it is sometimes difficult to prevent. So what I like to focus more on is how to recognize the symptoms so that if they develop, you can seek early treatment. So once the numbness and tingling becomes a relatively repetitive event in someone's life, such as nightly or in early morning or while driving or reading the paper, once those symptoms develop, it's very helpful to come in early and get treated. So the prevention is a little challenging because it's really your own natural anatomy that is starting to kind of fail, so to speak, over time. And so it's the early recognition of symptoms when it starts that's most important.
Okay, diagnosis is often with a test called EMG. What's that?
That's a very helpful test to assess the muscle as well as the nerve conduction study, which is often combined with that test to measure the speed and size of the nerve responses. And so with the EMG and the nerve conduction study, we can often grade severity of the problem as well as localize it to being at wrist or elbow or cervical spine. So that study is very, very helpful to differentiate several different conditions, all of which can result in similar symptoms of hand numbness and weakness.
Okay. All right, Dr. Steve Goldberg with Bell & Health in Titletown, and you can find Bell & Health Titletown right across from Lambeau and Ridge Road, or you can reach them at 920-430-4888. Thank you very much for that insight on carpal tunnel, Doctor. Appreciate your time.
Thank you.
Thank you.